So what you guys don't know is I've got what's technically called in the aesthetic world a long horse face, which means my chin is narrower than the rest of it. So it looks long and it gets longer as I've got older. So Mel's going to make it wider. So I look like Desperate Dan. Got it? Wallop! And action! Action!
As Ben so beautifully explained, we are going to do some dermal filler to give him more of a defined jawline. Now the techniques I use will be different for males and females, but I'll explain that as we go. I always start by giving the face a really good clean. With Ben, he had to have an extra clean because of his beard. I then mark out where I want to inject with the white pencil, as you saw. Now the technique I'm using here is with a needle, and it goes right down to Ben's bone and it injects just under his muscle. Now this generally is a technique that's used for males because I'm trying to widen the jaw. With females you wouldn't necessarily want to widen the jaw because it's quite a masculine feature. This technique can be a little bit tender because the needle goes right through all the different layers of the face until it gets to the bone. Ben has had numbing cream applied prior to us treating him. If you watch really closely, you may be able to see me pulling the plunger back of the syringe. Now I do this once my needle is where it needs to be, and all it does is it allows me to check that I'm not in a blood vessel. So whenever there's any injection of the face or any part of the body, there's always a risk that the filler could go into a blood vessel. Now this is just an extra precaution that I take to try and reduce those risks when using a needle at any point of the face. At various points through your treatment, I'll have a little feel, make sure I'm happy with my placement and that I don't want to tweak in any way. And then I'll explain what we've already done and what we're going to do next. So here's me explaining to Ben about the width of his chin. So although we'd have had a plan of action, I'd have explained what we were going to do to achieve the results we were hoping for, I will still talk you through the process as we go just to keep you informed. So I'm marking Ben's face up again, ready for the next section, and this time we're going to use what's called a cannula. A cannula is very similar to a needle in the sense that it can still inject the product where you need it to be. However, it's much longer and it's always blunt. So rather than piercing through all the different layers like the needle does, the cannula weaves its way through the tissues. So it reduces the risk of bruising because you're a lot less likely to pierce through any blood vessels, and it also reduces the risk of complications because the likelihood of, again, putting filler into a blood vessel is a lot slimmer than with a needle. So although the thought of a cannula can seem quite scary to many people, and in fact more scary than a needle, in my experience many people actually find it a lot more comfortable to have treatment with a cannula in comparison to a needle. I love this technique I'm using here. So all I'm doing is I'm inserting the cannula and then threading it along Ben's jawline because it allows me to do a really lovely long line of dermal filler. This technique is also beautiful for females. So if you're a younger female that doesn't have jowls yet, it can be incredible for creating a little bit of extra jaw definition without giving you the width. So it keeps you looking really nice and feminine. It's also perfect for anyone whose main concern is jowls. So as you can see, I'm inserting the cannula into the back of Ben's jawline. This is the same technique if you've got jowls. So the cannula would thread from the back of your jawline to meet the back of the jowl, and then you would have strands placed along the jawline, so it would give you depth and it would blend in the jowl without giving you the width, so you wouldn't look masculine. I'm also adding filler to the back of Ben's jawline to give a little bit more width there. So again, that is very much a male technique rather than a feminine technique. We've now moved to the front of Ben's jawline and to the chin area. So on Ben, he actually has quite a narrow chin in comparison to the width of his lips. So he needs added volume there. With a female, you generally don't want to give width to the chin because it's quite a masculine feature. You want to create point to the chin because that gives a very feminine appearance. I'm now adding filler to the front of Ben's jawline. Now this technique can also be great for females again who have got jowls. So by blending the chin with the front of the jowl, you're making it look less obvious and less prominent. So it gives you more of a defined jawline again, which is generally what you've lost when you have jowls. What you're seeing now is me adding a little bit of width to Ben's chin. As I said earlier, in comparison to his lips, Ben's chin is quite narrow. So by adding little bits to the side, it makes it look slightly wider. Adding that width for a male is great for masculinity. However, with a female, as I've already said, you wouldn't want to be adding width, you'd want to be adding point. By adding volume to the chin and creating more of a point, it can also pull the skin forward to help disguise the jowls a little bit more. An analogy that I absolutely love is if you imagine a mattress with a fitted sheet on, over time what happens is that mattress gets smaller, but yet you've got the same size fitted sheet. So over time, the fitted sheet looks slack, it doesn't look tight anymore. That's generally what happens to our skin. So what dermal filler's doing is it's adding width back to the mattress, which then helps the fitted sheet to fit better. This is the last part of Ben's treatment, and all I'm doing is balancing him out so the right side is the same as the left side. So I'm finishing off the front of the jawline and then adding a little bit of width again to the right side of his chin. Once I've finished, I'll always give a nice massage. Well, I say nice, you wouldn't want to pay for this type of massage. However, I'm just checking that the filler feels nice in the right place and that I'm happy that you can go home and it's not going to go lumpy in any way. So I give it a really nice clean to finish with, just to make sure that we reduce the risks of any infections. And that's it. Ta-da! You are done. And then what I actually do is I add a spray called Dermasil on top of the holes, and that just creates an invisible seal. So if you touch it or if you want to go home and apply makeup, you can, and it reduces the risks of any infections.